So coming back to the first question, when inserted into a patient, where is the LMA usually situated in relation to the vocal cord? So when we put a LMA in the patient, the LMA is always lies superior to the vocal cord, or inferior to the vocal cord, or posterior to the vocal cord, or lateral to the vocal cord. The answer is always superior to the vocal cord. That means the LMA will not pass. Suppose this is the vocal cord, the LMA will not pass inside the vocal cord, it will stay outside the vocal cord, and it will going on ventilation the trachea. So by the help of all this, and because the LMA is not crossing the vocal cord, hardly there will be chances of the tracheal mucosal injuries or the tracheal mucosal necrosis, or there will be the complications like post-op sore throat like there. So and also it is not like that if it is superiorly placed, it will not ventilate the trachea or it will not ventilate the lungs properly. It will go on ventilation the lungs properly, but hardly 80% of air will go to the lungs. Rest 20% were diverted mostly to the esophagus or mostly to the esophagus. But nowadays, when the LMA, we choose the LMA with the proper size and the newer LMAs, 99% of the air will go to the trachea. Okay, so it is when inserted into a patient, where is the LMA usually situated in relation to vocal cord? It is always superior to the vocal cord. Okay, fine. So this is the main behind the discovery of LMA. Dr. Archie Brain sir, and it is come in OSCE. We know that in OSCE anything can come. Okay, so some OSCE, suppose a photograph of this gentleman will came in the exam and write who is the scientist behind it and what are the contributions towards the anesthesia. So like these questions will come. Otherwise, simply LMA will come and side question is there, who discovered the LMA. So this gentleman is Dr. Archie Brain. Okay. Coming to the evolution of supraglottic airway devices, and no need to learn all this. So before that we use conventional LMA, first generation LMA, after that the second generation LMA, now the third generation LMAs, and the some superior LMAs like blockbuster LMA, LMA Supremes are there. So no need to remember 1981 में ये discovered हुआ था and 1988 में this was discovered, 1997 में this was discovered. So no need to mug up on all this. Just for the completion of the lectures, I am putting these slides. So this LMA is very important. In 2001, there will be a very revolution of LMA what takes place when the Procil LMA was discovered, because this Procil LMA is having so many advantages, and it will complete and nearly it replaces the endotracheal tubes in most of the general anesthesia. LMA Supreme, again IGL and pediatric IGL also. Before the discovery of pediatric IGL, we think about it how to put a general anesthesia in a patient by using supraglottic airway devices, but now pediatric IGL is available with us, so we can put a GA with supraglottic airway devices in pediatric patient too. Mostly we have done. So LMA or supraglottic airway devices, mostly they will ask about the advantage, disadvantage, and specific LMA you have to read, like protector, intubating LMA, blockbuster LMA, okay, Procil, LMA Supreme, and Basca mask, and IGL. This has to be read, and this has to be come in exam also. LMA protector, so many times it is asked. Blockbuster LMA, it is maximum time in the corporate hospitals during DNB practical exam. Blockbuster LMA is keep. Procil LMA, maximum time it was asked in exam. LMA Supreme is also asked. This Basca mask airway is also there in exam, and also there is IGL. Before going to exam, intubating LMA is very much having a typical feature you can differentiate. But when you compare LMA protector with the Basca, LMA Supreme, sometimes the candidates not able to identify what is LMA Supreme or LMA protector. So before going to exam, you have to clearly go through the pictures, and by seeing the pictures, you should be easily identified the LMA. And out of all this protector LMA, this blockbuster LMA, this LMA Supreme are the three new LMA, and there can be any time they can be asked in exams. So specific features related to protector LMA, blockbuster LMA, and LMA Supreme you have to read, and you always remember one LMA through which you cannot intubate, that is the LMA Supreme. This is always asked in the exams. Okay, thank you.